Hi everybody, it's Honest John. One of the things that's been on the news quite a bit lately is that it appears that autism is on the rise. They now say that 1 in 88 people have some form of autism spectrum disorder. So, what's the deal with that? Well, some people say we're better at diagnosing it, and there's some truth in that. But let me preface what I'm saying by letting you know I do have some knowledge in this area. I've got a master's degree in psychology, and I worked for years before I became a stand-up comic in the field of psychiatry and psychology. And see, here's the deal. Uh, there's a couple of things going on here. First of all, we all have some tendencies towards different types of mental illness. That doesn't make us ill, but all illness appears on a spectrum, and wellness appears on a spectrum. So let's say that you define normal as being this line. Now, there's nobody who's actually on this line. Some of us are a little above this line, some of us are a little below this line. So let me give you an example. This disease called bipolar disorder it used to be called manic depression because the classical symptoms are people who become very manic and then very depressed. But we all have our times when we feel real good and we're in a real good mood and we feel more outgoing and all that. And then there are other times when we're a little moody, a little uh, in a bad mood. And this is normal, right? This is not uh, being ill. Illness is when you go way above the line or you go way below the line. And so the same thing with autism. Um, some people have a tendency to be a little, what you might call a loner. Some people are what they call laconic, non-communicative. Um, and that doesn't mean that they are severely autistic, but they're somewhere on the spectrum. So what's happened is that they're now diagnosing autism on that spectrum rather than having to be uh, uh, a severe case. Kind of a whole lot of people now fall in line with that. Now here's the problem with that is that uh, non-sick people, people who are not sick, and behaviors that are within the normal realm are now diagnosable as part of that spectrum. And the whole purpose of this is, hey, psychiatrists and psychologists are in business just like anybody else, and they want to get coverage for when they treat people. So if you can define things that used to be considered normal, if maybe a little odd, um, if you can define those as part of an illness spectrum, you can get coverage for treatment. So somebody who at one time might have been considered uh, normal, but just on the quiet side and shy, a loner, is all of a sudden able to receive therapy for that, which is a good thing if you're the person. Uh, but if you're the insurance company, it's not considered so good. And there are some ethical questions involved here, about getting money for treating people who are fairly close to normal. I'm sure insurance companies don't much like that. Uh, it may be beneficial to society, but it's not beneficial to their bottom lines. And me, I don't give a shit about insurance companies' bottom lines, but they sure do. So basically, for those of us who consider ourselves to be healthy and well-adjusted people, which, and, hey, even crazy people sometimes think that. Uh, just remember, we're all just a doctor away from a diagnosis. Thanks for listening.